welcome to your favorite program, Healthy Conversations. My name is Pastor Philip Guy, and I'm your host for this program. In this program, we always discuss nothing but health. And you know, health is very important to each and everyone. It's important to you, it's important to me. And that's why in this program, we bring specialists, people with knowledge, people who can help us come to speed with matters health so that we can know how to live the best possible life we can. And today in studio, we have our guest, Dr. Danny Hong, who is going to help us in the topic that we'll discuss today. Welcome, Doc.
Thank you so much.
Thank you. Dr. Hong is a consultant physician with years of experience and has been a blessing to many people. He has reached out to many patients, and his education, his lectures have also been a blessing to many doctors and nurses and many people in the health practitioner. Now, today, we want to discuss on a very important topic called peptic ulcers. Peptic ulcers. Dr. Hong, what is this? Why is it called peptic ulcers?
So the word peptic means digestion. So digestion, usually peptic, we refer to the stomach. So the peptic, or the organ that digests, is the stomach. Yes.
So what is this peptic ulcers all about? What does it do to the body? When someone has peptic ulcers, what happens to this person?
So I think before we talk about the disease peptic ulcer, we need to understand the digestive process. Because when we understand what normal digestion occurs, then we can see what problems come up when digestion is hindered. So typically, when you and I take some food, digestion actually starts in the mouth because we mechanically digest the food. So we break food into smaller particles, and then we swallow them, which goes down into our stomach. So as they're going down to our stomach, they pass a tube called the esophagus, which is a straight tube that goes from the mouth all the way to the stomach. And when they enter the stomach, there's a second part of digestion, which is called chemical digestion. So the stomach produces chemicals and acid so that it can really break those small, fine foods that we have chewed into even smaller components so that once they leave the stomach, it can be absorbed by the intestines. And any problem along from the mouth all the way to the stomach or the intestines can lead to problems which we call indigestion. Indigestion means that we have a problem with digestion.
Yes.
So common indigestion problems include peptic ulcers, but peptic ulcer is a specific disease where the stomach develops an ulcer, which is a hole or a break in the skin or a break in the lining of the stomach. But before that happens, there's also other things like gastritis, which means inflammation of the stomach wall lining. There's also dyspepsia, which just means that there's a lot of bloating, a lot of gas, and they feel like uncomfortable in their stomach or uncomfortable in their abdomen. Yes. So those are all a spectrum of different types of things that they may feel.
Okay.
However, when people usually refer to stomach pain, they refer to it as ulcers, but they may not have an ulcer. They may just have maybe increased gas in their stomach, or they may have difficult digesting the food that's staying there for a while. But we refer to ulcers somewhat incorrectly because not everybody has an ulcer that has pain.
Okay. So that means not all stomach pain is necessarily ulcers. There is that stomach pain which would be attributed to ulcer, and there would be other stomach pains not necessarily attributed to ulcer.
Yes, and the only way to really diagnose an ulcer is by visualizing the ulcer. So as I said before, an ulcer is when the break off of the surface. So if you look with a camera inside the stomach, and that's something that we use to diagnose ulcers, it's called an endoscopy. You can actually see the pink healthy lining of the stomach, and in one area there's a white shallow hole. And if that hole gets deeper and deeper, it can even make a hole completely through the stomach. Yes.
So when a person gets ulcers, how do they feel? I've had people writhing in pain and crying, and they're in anguish, and they say they have ulcers. How exactly does one who experiences ulcers feel?
So it can be also a spectrum of symptoms. Sometimes they have a lot of burping, they have a lot of after eating, we call it postprandial fullness, where they feel it's very full, bloated, and tight. Sometimes there's a lot of gas, which also causes pain. At times it's also very sharp in that area. They can have severe vomiting and nausea with that area too. And if it's very severe, they can even bleed, because once the ulcer erodes through the wall, it can also erode through some blood vessels like the arteries or the veins, and that causes bleeding. So there's a variety of spectrum of different things they can feel, but most people usually feel some pain.
So one thing that we've been trying to follow with some of these diseases that we're talking about, doctor, is the root cause. What exactly is the root cause of ulcer?
So there are a variety of different causes for peptic ulcer disease. Of course, diet is one of them because the food that we eat directly impacts the health of the stomach. You know, so if we put in good food that doesn't irritate the stomach, that's healthy for the stomach to digest, then we won't develop problems. But there's also a second component, which is called infection, and that's usually from a bacteria called Helicobacter pylori, or H. pylori. Yes. And then a third cause of peptic ulcer disease is usually medications. So a lot of the painkillers that we're taking commonly cause ulcers and cause a lot of pain.
Okay. I've heard a lot about this H. pylori. Where does this bacteria come from? Is it from the food that we eat? Is it from the air that we breathe? Is it manufactured from the body? Where does this bacteria come from?
So no one knows for sure exactly where it came from originally, but we know that as bacteria, most things are transmitted. So yes, it does come from food. And historically, people used to believe that ulcers actually just came from the air, as you said. They said just, we don't know how people get it. So an Australian scientist who's named Barry Marshall, in the past decade, it was many, many decades ago, he was working in a lab trying to figure out exactly why do some people develop H. pylori in their stomach. So he would take the contents from a sick person's stomach through a tube, and then he would put it on a plate in the laboratory. And he would grow the H. pylori out there in a broth. And as he incubated, he was thinking, he says, is it possible that this bacteria from this person's stomach can be transmitted to other people? And at that time, people were laughing and saying, this is ridiculous. We don't know where this comes from, but it's not transmissible from person to person. So what he did was he took that broth and he drank the broth that had the bacteria.
What?
Yes.
He did that?
Yeah, some scientists are a little out there.
That's crazy.
Yes. Remember how we were talking about diabetes? Some people were tasting their own urine to see if it was sweet. That's how they were diagnosing diabetes. So what he did was, after he drank that broth of somebody else's stomach acid, which had the bacteria, within a few days, he developed severe symptoms of nausea, of bloating, of abdominal pain, and then he found that he also had H. pylori. So it's usually transmitted from a contact in the household. For example, if they're sharing the same food. We don't know exactly who gets it and who doesn't, because the body also has an immune response so that we can fight off infection too. But it's usually transmitted within local regions.
Thank you. Now, are there different types of ulcers? I've heard of gastric ulcer, duodenal ulcer. Are there different types, or is just one and the same thing?
So the ulcer is the same, which means that there's the integrity of the wall is breached and that there's a hole which is going through. So, you know, the duodenal or the stomach or gastric, it's just depending on where the location is. Stomach is the same thing as a gastric. Duodenal is the intestinal one. So ulcers can occur anywhere. Like you can have an ulcer on your heel, you can have an ulcer on the skin, you can have an ulcer inside the mouth, ulcer inside the stomach. So it just depends on where it's located.
Are there some types of ulcers that are more severe than others? Maybe some that are more painful than others?
So it really depends on the location. If the ulcer happens to go deep enough to cause bleeding, then that can lead to life-threatening bleeding. If the ulcer goes really, really deep, where it pops a hole inside the stomach or inside the intestine, then that's a surgical emergency where they'd have to go in and patch the hole. So it really depends on the location and extent of the disease.
Okay. Now, some of the lifestyle diseases that we talked about, we actually discovered that they're currently widespread across geographical territories. I don't know about this one, particularly peptic ulcers. Is it also found among the affluent, among the ordinary people, among certain populations and not other populations?
So H. pylori is, as a bacterial infection, is also regionally and geographically limited. So it's more common in the Asian, Middle Eastern, and also the African continent. However, peptic ulcers as a whole, remember, it's not just H. pylori infection, but it's also caused by the medications that they take, specifically the NSAID medications, and it's also caused by the diet that they're eating too.
Now, when you talked about H. pylori being common among the Asians, it brought me to think about spicy food. What is the impact on spicy food on ulcers? Does it have an effect?
Yes. So we know that spicy food, caffeine, chocolate, sweets, and oily and fatty foods directly cause issues with the digestion. Yes. And this leads to an important topic about what foods to avoid and what foods not to avoid. Because, the food that we're eating, primarily, the stomach needs to work really hard to break it down. So the stomach has a lot of acid already because the acid is there to help us. And sometimes people think that, oh, I need to get rid of the acid, it's causing me pain. But the opposite is true. The acid actually really helps to protect against infection. The reason why the stomach is so acidic is that when you're eating food, not all 100% of your food or your hands are clean. So that stomach acid provides an additional layer of protection by killing off the disease and the bacteria, in addition to helping us digest the food.
That's interesting. We'll talk a little bit more about that later, but let me take you back to the diagnosis of peptic ulcers. You talked about endoscopy and how intrusive is that, how painful is that when you have to insert a gadget inside my tummy to discover where this ulcers is?
Sure. So the first test would not be an endoscopy. Yes. And that is a little bit more invasive. So what we would start with we would start with non-invasive diagnostic methods. So that would be detecting for the cause of H. pylori as the cause of ulcers. So there's several ways. There's a blood test, there's a stool test, and a breath test. So the preferred test would either be the breath test or the stool test. I'll tell you why. So the blood test tests for the presence of the infection, whether it's been there for before or it's there now. So it doesn't differentiate whether or not you have this now. So somebody who's had a history of ulcers from H. pylori, if they've already been treated before, the blood test will still be positive. So because of that, it's not very reliable as, are they infected right now? So the other two tests are looking for the presence of the bacteria. So the breath test is directly looking for the presence of the bacteria which is producing the gas. It's called urea or urease. And then the stool test is looking for the presence of the bacteria in the stool. So these tests are more specific for, is my patient infected currently right now at this point in time? Yeah, so those tests are what we would be doing to diagnose the patient.
How would you comment on the accuracy of these tests? I've had people who have had ulcers and they've struggled with this thing for long, and after doctors trying to treat several other things, you find that one finally discovers, oh, it's been ulcers, and it's taken probably months or years when they've been trying to treat other things. How effective is the diagnostic process?
Yes, that's a very good question. So the test can have false negative results, which means that you may have H. pylori, but the test is negative. And the reason why is because H. pylori, as we said earlier, is a bacteria, which means it's something that can be treated with antibiotics. So if our patients have been taking lots of antibiotics for the strep throat, for the flu, for whatnot, then they would have maybe suppressed those bacteria and then made the test negative when they're in reality still positive for that infection. Another thing is that for the treatment of H. pylori, we give them anti-acid blockers. So that includes omeprazole, pantoprazole, esomeprazole, those different types of medicines. So if the patient has been taking medicines for ulcers but hasn't been treating the H. pylori, that would make the test negative, even though they have the disease.
Thank you so much, Dr. Hong. Dear viewer, this is Healthy Conversations, and today we are talking about peptic ulcers. In the past, we've talked about different types of diseases, whether it's hypertension, diabetes, obesity, and several others. And in this program, we just want to ensure that you get optimum health, that you are in vibrant health. And today in studio, we have our guest, Dr. Denny Hong, a consultant physician with years of experience, bringing us to speed on matters to do with peptic ulcers. Now, as we continue, Dr. Hong, tell me, at what point do doctors determine that now is the time to try and do endoscopy? Is it after trying several other tests and it has given false results, or maybe they've just had correct results but they want to have a confirmation?
That's a good question. So because endoscopy is invasive, we don't recommend it routinely. So we would screen which patients are at higher risk. And nobody goes for an endoscopy just to test for H. pylori because, as we said earlier, there's a stool test and a breathing test that you can use that's non-invasive and very accurate. But what we're worried about is that H. pylori and long-term peptic ulcer disease and gastritis, if untreated, leads to stomach cancer. So the role of screening with an endoscopy is primarily to look for cancer, or primarily to see, why is my patient not improving despite being on therapy? Is there another cause for this problem? Perhaps I'm chasing down the wrong hole and there's a completely different diagnosis.
Okay.
Yeah, so what we do is we typically refer them if we're concerned about any kind of stomach cancer, esophagus cancer, or there's non-responsiveness to therapy.
So how is this process of endoscopy done? Yeah, how intrusive is this? Do I have to go through some kind of anesthesia, some kind of numbness of some parts of my body so that I don't feel this pain?
Yes. So anesthesia has a variety of different ways of providing anesthesia to the patient. So there's the general anesthesia, which means that you're completely knocked out. You're on a breathing tube. You're on all these monitors and machines to keep your heart beating, all those other things. But for these kind of procedures, we use something called conscious sedation, which means that the patient is still conscious, but lightly consciously so that they don't gag. And the reason why is what they first do is they take a tube. It's a very long camera that's connected to a television. So what they do is at the tip you have the scope, which you can look to see, and it's displayed on a TV screen. And that goes into your mouth, and it must pass the mouth into the esophagus and go into the stomach. And for most people, they cannot tolerate something in their mouth, so they would have to gag or they may even vomit. So what we typically do to prepare these patients is we make sure that they're not eating, because we don't want the stomach to be full of food. And then we would also give them something to suppress the gag, and then we would keep them lightly sedated so that they are comfortable, so that they're not too anxious.
From my little biology in high school, I saw the teachers draw this lining of the stomachs in, winding. Does that tube go in and starts winding through my stomach like that?
So you can actually direct the tube. The operator or the doctor who's using that tube and also who's manipulating that one can also determine which direction it goes. So they can actually direct it to go left, right, up and down, and deeper and more shallow.
Are there any effects to this?
So very, very rarely are there any long-term effects. Sometimes if there is active bleeding, or if there's a vein there, or if there's some very friable area, looking with a camera can cause some bleeding because of local irritation. Yes, but that's only if the stomach is very inflamed. At that point in time, anything can make it bleed.
Okay.
Yes.
Now, earlier on you talked about the possibility of peptic ulcers leading to certain types of cancers. At this point, I would like you to just let us know what other effects, what would be the worst case scenario with the prolonged peptic ulcer or just a deep peptic ulcer on a patient? Yes.
So there are short-term and then long-term consequences. So the short-term ones would include pain and indigestion and discomfort. And if left untreated, it can progress to complications which are life-threatening, such as bleeding, and such as if there's a hole that pops through, then all the things inside the stomach will leak out. However, long-term consequences, what we really, really want to focus on is cancer. Because cancer is something that if it has spread, if it's local in one area, then it's relatively easier to treat. We can remove it and we can hope for the cure. However, once it has advanced and progressed and gotten bigger and spread through the blood to other areas, it can no longer be cured.
Okay. Apart from cancer, are there any other effects of peptic ulcers? Or that's just the worst case scenario?
The worst, absolute worst would be death. But
definitely.
Yeah.
Yeah. Now, tell me about the risk factors. When you talk about these lifestyle diseases, one thing that has been key to us here is to know the risk factors and just avoid what we can avoid. What would be the risk factors that would lead to peptic ulcers?
Yes, so there are several risk factors. So smoking is one of the major risk factors as well, because smoking really damages the blood vessels, and the stomach needs healthy circulation, because inside the stomach lining, there's a form of protective mucus layer. So you may wonder, if my stomach is so acidic, and then it's destroying all this bacteria and degrading the food, how come the stomach is not digesting itself? So some people are wondering about that.
So inside the same question.
Yeah, so inside the stomach lining, there's a layer of mucus. It's a slippery and it's a thin film, and the stomach is producing that. And it produces that when there's a hormone called prostaglandins, which increases the circulation to the blood, to the stomach, in the blood to the stomach. So that really protects the inside lining. But H. pylori and smoking and the diet, it directly in fact impacts the mucus lining. So the food that we eat can make the mucus lining more thin, or it can break through the mucus lining and cause the ulcers to develop there. So smoking directly impacts that. Other lifestyle factors include, of course, not eating correctly. So making poor nutrition choices, that directly also impacts the health of the stomach. Yes. And then we'll talk more about what foods to avoid and some myth of what foods cause ulcers.
We'll certainly talk about that, Doc. But now tell me about stress. Some people think that when they are stressed, they are likely to get ulcers or peptic ulcers. How is stress related to ulcers, as it were?
So stress does cause abdominal pain, but it hasn't been linked to directly cause a hole in the stomach or an ulceration. Stress lowers your immunity, so that it can decrease your ability of the body's ability to fight off infection. So a stressful body cannot tolerate against H. pylori, as it were. And then stress also leads to poor sleep, and poor sleep also decreases your immune system so that you are not able to digest food very well. And when people are stressed, they usually don't digest things, which means that the food may sit in their stomach and they may have bloating or an upset stomach. They may not be able to tolerate foods. And we see this commonly among students who are preparing for exams in the hospital. Around exam season, we have a lot of secondary candidates who come in because they're having so much stress from pressure from the school that they're coming in with abdominal pain. And even though we say that they have ulcers, what they really have is probably some dyspepsia or some indigestion, but it may feel the same.
So, Doc, when someone comes to you as a patient and and they have ulcers, what are the common things that they complain about? What do they tell you that they are feeling?
The most common thing that they're feeling is a fullness in their abdomen, sharp pains, and difficult to digest the food, and occasionally nausea and vomiting. So it's very non-specific, and those symptoms can be experienced by other diseases, but it's usually some abdominal discomfort.
Are there some specific locations within the abdomen that would lead to, deciding that this could be an ulcer case, or it's just general?
So typically, people complain about pain above the stomach, so that's called the epigastric. The gastric is the region which is next to the stomach, and epi means above. So it's above the stomach, right here in the middle. Yes, but that can also be because they have heartburn. And so heartburn is something called esophageal reflux. So that's also something that a lot of people experience when they're under stress, is that the food and the acid in their stomach sometimes shoots up into toward the mouth cavity. And it's maybe worse when they're lying down, it may be worse after a meal. So that reflux and that heartburn can also cause a lot of pain as well.
If someone has had like ulcers for a very, very long time, and someone that has just had little bouts of these ulcers, would there be a difference in the way you treat these two patients?
Sure. So typically the standard way that we treat ulcers is we give them medications to block the body's ability to secrete acid in the stomach. So almost all of those medicines work at making the stomach's acidity at an alkaline level. So we talk about pH, which is the level and monitoring of how acidic or how non-acidic something is. So the acidity is there, and people for long have believed that this acidity causes problems.
Yes.
And in an ulcer case where there is a hole and a break in the lining of the stomach, it's true that the ulcers can sometimes be aggravated by the acid. But rather than just giving them medicines that decrease the acidity of the stomach, we should address the root cause. Yeah.
So tell me, when I probably think I have ulcers, so when I get symptoms that appear to be like ulcers, when is the right time to see a doctor?
There's no wrong time. You're welcome anytime. In fact, it's best to see them when you're feeling well, so you prevent disease. Because most times when you come in and you're very, very sick, we wish you'd come in earlier. So there's no wrong time of visiting the hospital.
So what would be the adverse effects then of not seeing a doctor when you have ulcers?
So as the disease progresses, it can develop into cancer, as we said earlier, and other complications. So we really want to catch those beforehand. And long-standing chronic illnesses really lead to, it's much more harder to reverse something when it's been there for long. So when my patients come immediately and we address it immediately and we can try to fix those things, it's much more easily to reverse and they can live on their lives without any complications. But when they've sat on it for long, when they've delayed and waited for treatment, oftentimes it may have progressed to a stage where it's not often curable.
Thank you, Doc. Now, I'm looking at the medical practitioners who deal with ulcers from time to time. Sometimes some of them also may need an advice here or there when they have to deal with ulcers cases of ulcer. What would be the kind of advice that you'd give to other medical practitioners in matters peptic ulcer?
So I think that because some of the diseases are so common, we tend to overlook them. Let me give you an example. For example, in our region, we have a lot of malaria.
Yes.
So as soon as someone's diagnosed with malaria, we stop searching and we say, all your problems are because you have malaria. But in reality, because malaria is so common in our region, it's not unlikely that they have malaria plus something else.
Yes.
Like that they come in for nausea and vomiting, and maybe they have both peptic ulcer disease and malaria. So, because a disease is common, I would urge you that if the symptoms don't exactly fit with this problem, then you continue searching to make sure that we're not missing anything.
Now, you had earlier on said that there's a possibility of getting a false negative. What would then these medical practitioners do when they get a false negative result?
So the temptation for false negative results is to not treat the patients. But like I said, that the test can only be interpreted accurately if somebody hasn't been taking antibiotics or if they haven't been taking any antacids. So if you really want the test to be accurate, you should wait 4 to 6 weeks after stopping those other drugs before testing the client.
46 weeks?
4 to 6 weeks.
4 to 6 weeks?
Yes. 4,
Okay.
5, or 6 weeks, yes.
After testing, when tested after 4 to 6 weeks, there is a more likelihood of getting a better result?
Yes, then the positive predictive value of that test is much more accurate.
So that means you have to stop these antibiotics for some time, or what would you do?
Yes, so you can either stop all the medicine and then retest them, or you can even treat them as if they have the disease. Yes, and that's not a bad option in some cases because testing may be cost prohibitive because the test may be just as expensive as the drug themselves.
Sure.
So in some cases where you know that H. pylori is so prevalent and it's so common, sometimes I'll just offer to treat the patient because they may not be able to afford or have access to the diagnostics.
Okay, so it's better to go ahead and treat anyway.
Yes, because you don't want them to develop long-term effects of cancer and patients may not follow up regularly, sometimes it's better just to treat them so that they don't develop complications.
What would be the effect of treating peptic ulcers when it's not there?
So they may have some side effects from the medications, which include diarrhea, some bloating, and some people don't tolerate the medicines. But the good thing is that the duration of the medicine is only 14 days. So after they finish, there should be no long-term consequences.
It will clear out.
Yes,
and
yes.
they'll be just fine after that.
Yes, they shouldn't develop complications.
Okay, thank you so much, Dr. Danny Hong. This is your favorite program, Healthy Conversations. And Dr. Hong has been our guest here, bringing us to speed in matters to do with peptic ulcers. We've heard of the causes of peptic ulcers. We've heard of the effect it has had on the patients. And in the next part of our conversations, we'll be talking about how to cure peptic ulcers. We'll be talking about different things on what not to do and what to do when you have peptic ulcers. So please keep it Hope Channel Kenya. Please stay right there, and we're looking forward to seeing you in our next session of Healthy Conversations. Please remember to talk to us. Facebook page is listed on your screen, our WhatsApp number, and phone contacts. Please get to us. If you have any questions, please let's converse. This is Healthy Conversations, and this program is just for you. I'm your host, Pastor Philip Guy, and thank you for watching. Be blessed.